Today we have the pleasure of having with us Dr. Cleve Ziegler. Dr. Ziegler is an obstetrician-gynecologist working at the Jewish General Hospital, and he's also an assistant professor at McGill University. Dr. Ziegler, welcome today.
It's a pleasure to be here, Lorraine.
Thank you. So, as you know, women, we go through many changes in our life. A lot of hormonal changes. We go through puberty, we go through pregnancy, postpartum, and then the last stage would be menopause. I'd like you to define to us what menopause is exactly.
The definition of menopause really is strictly 1 year without a menstrual period. But menopause is sort of a transition, so it's not an on-off switch. Women go through a phase generally in their late 40s where their menstrual cycles become increasingly irregular, and sooner or later, they eventually stop. The average age is about 52, but there's a range, and that range can be anywhere from about 47 up to 57. So the definition of menopause is 1 year without a period, but as I mentioned, it's a sort of a transitional period.
So you mentioned that there was a range. It can go all the way up to 60 years old. But what happened physiologically exactly so we stop having our period?
Sure, in a very short answer, women stop making a hormone called estrogen. So with age, our ovaries, which have eggs, which normally produce two hormones during a woman's lifetime, estrogen and progesterone, those eggs start to fail and start to stop functioning. So essentially all the symptoms of menopause are related to a deficiency of a hormone called estrogen.
When women present yourself to your office, what are the main complaints that they have?
Probably the most defining complaint of menopause are hot flashes. These are very uncomfortable feelings of sweating and heat that can occur at night and disrupt sleep with a big impact on a woman's quality of life. They can occur during the day. The other signs or symptoms of menopause are related to what happens to the genitals. So women develop vaginal dryness, pain with intercourse, and various symptoms associated with lack of estrogen in that area of the body.
Tell me a little bit more about the sleep issues.
I mean, in general, over the past 20 years, there's been a lot of literature on the importance of sleep for health, both in men and women. So lack of sleep doesn't necessarily have a worse impact on women than men. But women tend to have poor sleep in menopause because those women who experience bad hot flashes will wake up repetitively over the night and they won't have restorative sleep. The impact is significant on mood, on functioning, on general health. I think it's important that women realize that sleep disruption in this part of their life may not exclusively be related to menopause and the lack of estrogen associated with it. But to the extent that the hot flashes disrupt sleep, we can improve those symptoms by giving women hormone therapy, and it's of major benefit for that symptom.
What about brain fog? We hear about that.
So again, that's also a bit tricky. I think with age, for both men and women, there is brain fog. I mean, I forget phone numbers, I forget things that I should remember. I think a lot of the brain fog is related to the lack of sleep, which interferes with cognition. But independently of that, women in this age group will often mention a lack of mental clarity, trouble remembering things. Clearly, some of it is related to hormone deficiency, but there may be other factors too.
Could you explain to me what hot flashes are exactly?
Sure. So it's a very uncomfortable feeling for a patient. Women describe it as a heat feeling arising sort of from the area of the chest, going up to their neck and going up to their face. It's often associated with a bit of sweating, or quite a bit of sweating, depending on the patient. It can disrupt sleep, where it has a major impact on overall quality of life, but it can also occur during the day and interfere with work and other activities.
And how do you explain it?
Right. So the scientific explanation is well understood. Estrogen is a hormone that's very involved in regulation of body temperature. There's a center in the brain that helps us regulate our body temperature. With menopause and the dropping levels of estrogen, there is a malfunction in that center so that patients experience these heat feelings. Very small changes in actual temperature can make women feel very hot and sweaty. It's a very uncomfortable feeling. It is really the defining symptom of menopause.
Truly, truly. And tell me, how long do they last usually?
So we actually have very good information on this. There have been a couple landmark studies published in the past 5 years in very high reputation journals. I think two key points came out of this study. One, that many women start to suffer from these symptoms in their mid to late 40s, even before their periods have stopped, and that women who start suffering younger suffer longer, so that 5 to 7 years seems to be the average. The other piece of information that came out of this was that across ethnic groups, all women suffer from hot flashes. It's not something that's limited to any one ethnic group.
What is the best treatment for hot flashes?
So the answer to that question is very clear. As we've been discussing, it is the most bothersome symptom for menopausal women. I think first of all, lifestyle itself is very important. So that includes maintaining a healthy weight, limiting alcohol consumption. Certainly drinking in the evening can really exacerbate hot flashes. Seeing what other medications they're on that may have an impact on this way. Hormones aren't the answer for everything. And remember that all the symptoms of menopause are not related to hormone loss. Some women may become depressed at this point in their life, may have other factors that need to be evaluated by their doctor. So it's important that the approach be individualized for every patient.
Another thing that really puzzles me, and I would like us to discuss it a little further, is women are scared. Some women are very scared of hormone replacement therapy. What do you have to say about that? So
the single biggest fear for women is the association in their mind between hormone therapy and breast cancer. So it really depends on which hormone, how long the hormones are taken, other issues related to family history. So the fact is, though there may be a very small association with estrogen, progesterone, hormone therapy, and breast cancer, when we compare that risk to other risk factors that women may have, their weight, alcohol consumption, family history, the magnitude of that relationship is actually not that big. The other issue is that there are now new treatment options that get away from conventional estrogen progestin treatment, new drugs, new compounds that may have a much less significant impact on the breast than hormone therapy does. So this whole field continues to evolve and develop, and I think it's important that patients get an opinion from a doctor who's knowledgeable.
Dr. Ziegler, thank you so much for being with us today.
It was a real pleasure to talk to you, Dr. Dontigny.
Thank you.